Adrian Gelb, on behalf of the organising committee, thank you so much for attending our conference. This morning you were able to highlight a very major advance in anaesthesia care in the setting of the whole of the world. Can you just quickly tell us what that's about?
Yeah, absolutely. Thank you for inviting me and asking me. So what we've just published out today is the World Health Organization, World Federation of Societies of Anesthesiologists, International Standards for a Safe Practice of Anesthesia. What this does for anesthesia worldwide is, one, standards are now international. They're endorsed by the World Health Organization, and therefore they deserve and will get the attention of ministries of health. And we've put some very important geopolitical things in there, that anesthesia is the practice of medicine, that anesthesia should, whenever possible, be provided by a physician anesthesiologist, and we've set standards that are independent of provider. It doesn't matter if you're working in Kiribati or you're working in Guatemala, and who's providing the care, the standard should be the same.
Thank you, Adrian. Why was it so important for you that the practice of delivering anaesthesia should have been, is a medical act?
I think given the complexity, particularly these days, of surgery, it really does involve having a good, rounded medical education as the fundamental basis. And it fits with our belief that perioperative medicine is really the space, the area that we need to be working in. There's some types of anesthesia in isolation can be done by a lesser provider, but the overall management really is medical care of medically complex patients.
Yes, thank you. I mean, Adrian, I think that's something all Australian anaesthetists would agree with you on. You made a comment, I found it very interesting, that trainees, anaesthesia trainees and students seem to have a particular interest in pursuing World Federation objectives. Why do you think that might be? Is that just a reflection of the new generation having a greater interest in that topic?
I think it really is a generational thing, and in some ways, for some of us, it almost harkens back to the spirit of the 60s, of making the world a better place, playing a role in doing that, but without the confounds of what you smoke or what you ingest. But seriously, it really is heartening, and at least in North America, it's becoming a consideration in where medical students choose to go to medical school and where they choose to do the anesthesia training.
Yeah, that's amazing. Adrian, one other thing, not many people would know this in Australia, but I've been to China, I've been there when you're there, and they call you the godfather of Chinese anaesthesia. We've had Michael Cousins being the Placido Domingo of Australian anaesthesia. How did that come about? Just tell me about your relationship with Chinese anaesthesia and how it's come about.
Well, it goes back about 30 years, but I practiced in Canada for most of my life before moving to San Francisco, the independent Republic of San Francisco these days. And Canada had fewer restrictions on Chinese trainees. And when I was a young faculty member, the chair of the department was part of the first delegation of Western anaesthetists to go to China. And then he brought back a young Chinese doctor, and it just created an ongoing relationship. Every few years initially, then every year somebody would come from China. And as I mentioned to you, I think yesterday, over the past 18 years or so, every president of the Chinese Society of Anesthesiologists has had some interaction with me over my career and their career. So in some ways, it's been a mentorship activity, it's been a friendship thing. I had students there, then I had grand students there, and I now have great-grand students. I still have mentees in the residency training programs around China. Love working with them.
Adrian Gelb, on behalf of all Australian anaesthetists, New Zealand anaesthetists and anaesthetists all around the world, congratulations on the amazing body of work you've done, and we're all indebted to you.
Thank you very much,
you.
Michael. My pleasure.
Cheers.